Most major surgeries would not be possible without anesthesia to render a patient unconscious and pain-free and to ensure that their vital functions including blood pressure, breathing and heart rate and rhythm remain stable throughout the procedure. I'm Mr. Zaman and today I'm going to discuss about the growing demand for such surgical care, many clinicians including anesthesia care teams and their risk factors on patient safety. A new study appeared in JAMA Surgery from a team at the University of Michigan which examined if the number of overlapping procedures managed by the anesthesiologist increases the risk of death or complications after surgery. Using data from the Multicenter Perioperative Outcomes Group electronic health record registry, the team investigated surgical procedures that involved an anesthesiologist directing a CRNA or an anesthesiology resident. This anesthesia care team model is the most common model used to deliver anesthesia in the United States, focusing their analysis on cases with CRNA involvement and minimal anesthesiology resident involvement. They identified patients with similar demographics and health statuses who underwent surgical cases of various types, including general, gynecologic, neurologic, otolaryngologic, orthopedic, urologic, and vascular procedures. For each patient, they calculated the average number of concurrent surgeries that were managed by that patient's anesthesiologist during the patient's procedure. They then compared instances where the anesthesiologist was directing one between 1 to 2, 2 to 3, or 3 to 4 cases at a time. Overall, 5.19% of cases resulted in some form of post-surgical complication, that is 30-day mortality or one of 6 major surgical morbidities: cardiac, respiratory, gastrointestinal, urinary, bleeding, and infectious complications. When compared to an anesthesiologist directing anesthesia for 1 to 2 overlapping surgeries, directing anesthesia for 2 to 3 or 3 to 4 overlapping surgeries led to an increase in the rate of morbidity and mortality. Instances where the anesthesiologist was directing 3 to 4 surgeries at a time had a complication rate of 5.75%, a 14% increase compared to the complication rate of 5.06% for 1 to 2 overlapping surgeries. Researchers concluded that anesthesiologists have been saying for a long time that covering 4 rooms is possible but should be reserved for situations where they think it is safe. Increasing overlapping responsibilities may have some potential downsides that balance the advantages of potential cost savings and access to care. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.